Right now, as you're watching this video, somewhere in America, a 63-year-old man is swallowing a pill that his doctor prescribed months ago. He trusts it. He has no reason not to. And within the next 72 hours, that same pill will trigger a cardiovascular event that changes his life forever. This is not fear. This is published medical science. The New England Journal of Medicine, Stanford University, the FDA itself, Johns Hopkins, the American Heart Association. These are not fringe sources. These are the institutions that write the rules of modern medicine. And right now, the research they've published is screaming a warning that most people over 60 have never heard. There are 6 commonly prescribed medications, 6 pills that millions of seniors take every single day, that have been scientifically shown to skyrocket the risk of heart attack, stroke, and sudden cardiac death. Some of these medications are available without a prescription, sitting in your bathroom cabinet right now. And the worst part? Many doctors continue to prescribe them without ever mentioning the cardiovascular risk. I'm Dr. Steven, the Green Physician, and today, I'm not going to sugarcoat anything. I'm going to walk you through each of these 6 medications, show you the exact studies, the exact numbers, and the exact mechanisms by which they damage your heart. And then, I'm going to show you what nature has provided as safer alternatives, because nature already has the answer. Before we begin, if you are over 50 and take any medication daily, I need you to do one thing. Subscribe to this channel and turn on the bell, because every week I break down the science that could save your life or the life of someone you love. Let's begin. Medicine number 1. Non-steroidal anti-inflammatory drugs. You know them as ibuprofen, Advil, Motrin, Naproxen, Aleve, diclofenac, Voltaren. These are the most commonly used painkillers on the planet. In the United States alone, more than 30 million Americans take NSAIDs every single day. And if you're over 60, there is a very high chance that one of these bottles is sitting in your kitchen right now. Here's what the science says. In 2015, the FDA took the extraordinary step of strengthening its black box warning, the most serious warning the agency can issue, on every single NSAID except aspirin. The warning states clearly, NSAIDs increase the risk of heart attack and stroke, even in people with no prior history of heart disease, and that risk can begin within the first few weeks of use. Let me say that again. The first few weeks. A landmark study published in the British Medical Journal in 2017, led by Michelle Bally and her colleagues, analyzed data from nearly 450,000 patients. They found that any dose of NSAIDs, taken for as little as 1 week, was associated with an increased risk of heart attack. The risk was 20 to 50% higher depending on the drug and the dose, and for ibuprofen specifically, the risk was highest during the first 30 days of use. But why? How does a simple painkiller attack your heart? NSAIDs work by blocking an enzyme called COX-2, which reduces inflammation and pain. But COX-2 also produces a substance called prostacyclin. Prostacyclin is one of your body's most important protectors. It prevents blood clots from forming inside your arteries. It keeps your blood vessels relaxed and open. When you take an NSAID, you suppress prostacyclin, and that shifts the balance inside your blood vessels toward clotting, toward constriction, toward a heart attack. And here's the part that most people never hear. NSAIDs also cause your body to retain sodium and water, raising your blood pressure and making your heart work harder with every single beat. For someone over 60 whose arteries are already narrowing, this is like pouring gasoline on a smoldering fire. The drug rofecoxib, sold as Vioxx, was an NSAID that caused an estimated 140,000 heart attacks in the United States alone during the 5 years it was on the market. It was pulled in 2004, but the damage was already done, and the lesson should have been clear. NSAIDs are not harmless. If you suffer from chronic joint pain or arthritis, and you've been relying on ibuprofen or naproxen, talk to your doctor about alternatives. Nature offers powerful anti-inflammatory compounds. Curcumin from turmeric, when taken with black pepper for absorption, has been shown in multiple studies to reduce inflammation at levels comparable to ibuprofen without the cardiovascular risk. Omega-3 fatty acids from wild-caught fish or flaxseed oil reduce systemic inflammation through entirely different pathways. Boswellia serrata, an ancient resin used for thousands of years, inhibits the 5-LOX enzyme, reducing inflammation without touching KIOX2 at all. Medicine number 2, proton pump inhibitors, PPIs, omeprazole, Prilosec, Nexium, pantoprazole, Protonix, lansoprazole, Prevacid. If you've ever had heartburn, acid reflux, or been diagnosed with GERD, there's an extremely high chance you've taken one of these. More than 100 million prescriptions are filled every year in the United States for PPIs, and many people take them for months, even years, far longer than any label recommends. For decades, PPIs were considered among the safest drugs in medicine. That is no longer the case. In 2015, researchers at Stanford University conducted one of the largest data mining studies ever performed on PPIs. Dr. Nigam Shah and Dr. Nicholas Leeper analyzed the electronic health records of nearly 3 million patients. They crunched trillions of data points, and what they found shocked the medical community. PPI use was associated with a 16 to 21% increase in the rate of heart attacks across all adult users, even those under 45, even those with no prior history of heart disease. And when they examined a separate cohort of 1,500 patients with chest pain or abnormal stress tests, PPI use more than doubled the risk of a major adverse cardiovascular event. Dr. Leeper said it directly, quote, "These drugs may not be as safe as we think," end quote, but here's the mechanism that makes this truly alarming. PPIs don't just reduce stomach acid. They impair the production of nitric oxide in the endothelial cells that line your blood vessels. You have nearly 100,000 miles of blood vessels in your body, and nitric oxide is the molecule that keeps them relaxed, flexible, and open. When nitric oxide drops, your arteries stiffen, your blood pressure rises, and the conditions for a heart attack are set. A separate study from Johns Hopkins University confirmed this association, finding that long-term PPI use was linked to twice the risk of total cardiovascular disease and heart failure compared to non-users. And here's what's even more concerning. A study published in the European Heart Journal of Cardiovascular Pharmacotherapy found that PPI use was associated with an increased risk of out-of-hospital cardiac arrest in the general population. Not in hospitalized patients, not in people with existing heart disease, in everyday people living their normal lives. If you're taking a PPI for heartburn or acid reflux, please do not stop taking it without consulting your doctor. But ask about alternatives. H2 blockers like famotidine, brand name Pepcid, showed no association with increased heart attack risk in the Stanford study. For natural approaches, deglycyrrhizinated licorice, known as DGL, has been shown to soothe the stomach lining and reduce acid symptoms. Aloe vera juice, taken before meals, coats and calms the esophagus. Slippery elm bark is another traditional remedy that creates a protective mucilage layer in the digestive tract. Medicine number 3, azithromycin, the Z-Pack. This one will surprise you because you don't take it every day. You take it for 5 days when you have a sinus infection, bronchitis, or a respiratory illness. Your doctor hands it to you like it's candy. 5 days. Done. Move on. But in 2012, a study published in the New England Journal of Medicine changed everything we thought we knew about this antibiotic. Dr. Wayne Ray and his team at Vanderbilt University analyzed data from the Tennessee Medicaid program, comparing millions of prescriptions for azithromycin against amoxicillin and other antibiotics. And what they found was stunning. During a standard 5-day course of azithromycin, the risk of cardiovascular death was 2.49 times higher than with amoxicillin, and compared to taking no antibiotic at all, the risk of cardiovascular death was 2.88 times higher, 2.88 times during just 5 days of treatment. The FDA issued a safety communication following this study, warning that azithromycin can cause abnormal changes in the electrical activity of the heart, a condition known as QT prolongation. QT prolongation disrupts the rhythm of your heartbeat. It can trigger a fatal arrhythmia called torsade de pointes, which can cause the heart to simply stop. For someone over 60, whose heart's electrical system is already slowing with age, whose potassium or magnesium levels may be slightly low, who may be taking other medications that also prolong the QT interval, this 5-day Z-Pack becomes a ticking time bomb. If you need an antibiotic for a respiratory infection, ask your doctor whether amoxicillin or another safer alternative might work just as well. And to support your immune system naturally, so you need antibiotics less often. Raw garlic contains allicin, one of nature's most powerful antimicrobial compounds. Elderberry extract has been shown in clinical trials to reduce the duration and severity of respiratory infections, and medicinal mushrooms like reishi and turkey tail modulate the immune system in ways that help your body fight infections without pharmaceutical intervention. Medicine number 4, oral decongestants, pseudoephedrine, Sudafed, phenylephrine. These are the drugs millions of Americans reach for when a cold or sinus infection clogs their head. They're available everywhere, no prescription needed, and most people take them without a second thought. But the American Heart Association has issued a clear warning. People with uncontrolled high blood pressure or heart disease should avoid taking oral decongestants. This is not a suggestion. It is a guideline from the AHA and the American College of Cardiology, published in their 2017 blood pressure management recommendations. Here's why. Decongestants work by constricting blood vessels. That's how they reduce swelling in your sinuses. They squeeze the blood vessels shut, but they don't just constrict the vessels in your nose. They constrict blood vessels throughout your entire body. Your blood pressure rises, your heart rate increases, and for someone over 60 with narrowed coronary arteries or existing hypertension, or early-stage heart failure that hasn't even been diagnosed yet, this sudden spike can be the event that pushes them over the edge. Dr. Aaron Mikos, Associate Director of Preventive Cardiology at Johns Hopkins, has stated that decongestants can exacerbate or worsen heart conditions. She specifically warns that the biggest concerns are for people who have had a heart attack or stroke, or have heart failure or uncontrolled high blood pressure. But here's the hidden danger. Nearly half of Americans over 60 have high blood pressure, and many don't know it. They walk into a pharmacy, grab a box of Sudafed, take it for a week, and never realize they just subjected their cardiovascular system to days of elevated pressure and arterial constriction. Instead of oral decongestants, try nasal saline irrigation. It physically flushes mucus and pathogens from the sinuses without affecting blood pressure at all. Steam inhalation with eucalyptus oil opens the airways naturally. Peppermint tea contains menthol, which provides a natural decongestant effect, and staying hydrated, truly hydrated, thins mucus secretions and allows your body to clear congestion on its own. Medicine number 5, corticosteroids, prednisone, prednisolone, dexamethasone, methylprednisolone. If you have rheumatoid arthritis, lupus, inflammatory bowel disease, polymyalgia rheumatica, or any autoimmune condition, there is a high chance you've been prescribed one of these. They are among the most powerful anti-inflammatory drugs in medicine, and for acute flare-ups, they can be life-saving. But the long-term cost to your heart is staggering. A major study published in PLOS Medicine by researchers at the University of Leeds analyzed data from nearly 88,000 patients with immune-mediated inflammatory diseases in the United Kingdom. None of them had pre-existing cardiovascular disease when the study began. After just 1 year of treatment, patients taking less than 5 milligrams of prednisolone per day, the lowest possible dose, had a twofold higher absolute risk of fatal and non-fatal cardiovascular events, including heart attack, heart failure, atrial fibrillation, and stroke, compared to those not taking steroids. And for those taking 25 milligrams or more per day, the risk was 6 times higher. The lead researcher, Dr. Mar Pujadas Rodriguez, stated directly, quote, "Most physicians would think that at doses of less than 5 milligrams, the risk of toxicity is minimal. But what we are seeing more and more is that this is not true and the risk remains high." End quote. The mechanism is multifaceted. Corticosteroids promote insulin resistance, raising blood sugar. They cause the body to retain sodium and water, increasing blood pressure and blood volume. They accelerate the deposit of fat around the abdomen and in the visceral organs. They weaken blood vessel walls, and they create a state of chronic metabolic disruption that the heart simply cannot sustain over months and years. For every additional 5 milligrams per day of corticosteroid use, the risk of cardiovascular disease increases by 9%. There is no safe long-term dose. If you must take corticosteroids for a serious inflammatory condition, work with your doctor to find the lowest effective dose and reduce it as quickly as safely possible. Meanwhile, nature provides powerful support. Turmeric with piperine, boswellia, omega-3 fatty acids, and ginger root all possess anti-inflammatory properties that can reduce your reliance on steroids. They are not replacements, but they are allies, and they do not damage your heart. Medicine number 6. And this is the one that should concern every single person over 60. Polypharmacy. The concurrent use of multiple medications that each carry cardiovascular side effects. In 2022, researchers at the University of Southern California's Schaeffer Center for Health Policy and Economics published a groundbreaking study in the journal Pharmacoepidemiology and Drug Safety. They analyzed data from nearly 3,700 older adults aged 61 to 86, with no prior history of cardiovascular disease, and followed them for 9 years. What they found should be front-page news. Older adults taking 2 or more medications with known cardiovascular adverse effects at the same time had double to triple the risk of heart attack, stroke, or death. Compared to those not taking these medications, the risk increased with each additional medication added. And here is the finding that shook the cardiology world. Even patients who were taking statins, the gold standard for cardiovascular prevention, experienced increased heart attack risk when they were simultaneously taking other medications with cardiovascular side effects. The statins could not overcome the damage being done by the other drugs. The lead researcher, Dr. DiMiccato, stated, quote, "Simply prescribing statins for cardiovascular prevention without considering the cardiovascular risks of other medications a patient is taking may sometimes increase and not reduce the risk of stroke, heart attack, or death in older patients." End quote. The combinations that carried the highest risk involved opioid painkillers used together with NSAIDs, antidepressants, and bronchodilators. These combinations doubled the risk of a major cardiovascular event. And here's the number that should alarm you. 50% of the adults in this study were taking at least one medication with a known cardiovascular adverse effect. 12% were taking two simultaneously. 6% were taking three or more. This is the hidden epidemic. It's not one pill. It's the combination, the interaction, the cumulative load on a heart that is already aging, already narrowing, already working harder than it should. Talk to your doctor, or better yet, talk to a pharmacist who specializes in medication review. Ask them to look at every single drug you take and identify which ones carry cardiovascular risk. Ask whether any can be replaced, reduced, or eliminated, and wherever possible, support your body with nature's pharmacy. Because plants don't interact the way pharmaceuticals do. They work with your biology, not against it. Let me be very clear about something. I am not telling you to stop any medication. That decision belongs to you and your doctor. What I am telling you is that the science is clear, and the science says that these 6 categories of medication carry real, documented, peer-reviewed cardiovascular risk, especially after the age of 60. The FDA has issued black box warnings. The New England Journal of Medicine has published the data. Stanford, Johns Hopkins, the University of Leeds, USC, the American Heart Association. These are not opinions. These are facts. And the most important fact of all is this: you have a right to know. You have a right to ask questions. You have a right to demand safer alternatives. And nature has been providing those alternatives for thousands of years. If this video opened your eyes, I need you to do 3 things right now. First, share it with someone over 60 who takes medication daily, because this information could save their life. Second, subscribe to this channel and hit the bell, because every week I bring you the science that the system doesn't always make easy to find. And third, drop your age in the comments. Tell me how old you are and what medication you're currently taking. Let me know you're part of this community, because together, we are building something powerful. I'm Dr. Steven, the Green Physician. Remember, nature already has the answer. I'll see you in the next video.